Welcome to our comprehensive guide on periodontal treatment planning. The ultimate goal is to achieve total treatment, which means coordinating all procedures to create a well-functioning dentition within a healthy periodontal environment. A treatment plan acts as the blueprint for managing each case, ensuring periodontal health is established and maintained. Every step is carefully sequenced and planned in advance, so nothing is left to chance. By following a systematic approach, clinicians can address all aspects of dental health, from emergencies to maintenance. Let's explore each phase in detail, starting with the preliminary phase. The preliminary or emergency phase is the first step in the treatment plan. This phase focuses on addressing urgent dental issues that require immediate attention. Emergencies such as dental or periapical abscesses, periodontal abscesses, and extraction of hopeless teeth are managed here. If necessary, provisional replacements are provided to ensure patient comfort and function. By resolving emergencies early, the foundation is set for subsequent therapeutic procedures. This phase is crucial for stabilizing the patient and preventing further complications, allowing for a smooth transition into the next stages of treatment. Dental and periapical abscesses are common emergencies in periodontal practice. These infections can cause severe pain and swelling, requiring prompt intervention. Treatment typically involves drainage of the abscess, antibiotics if necessary, and addressing the underlying cause. By managing abscesses effectively, clinicians prevent the spread of infection and alleviate patient discomfort. This step is vital in the preliminary phase, ensuring that acute issues are resolved before moving forward with comprehensive periodontal therapy. Periodontal abscesses are localized infections within the gum tissue. They can develop rapidly and cause significant discomfort. Treatment involves careful drainage, cleaning of the affected area, and sometimes antibiotics. Extracting hopeless teeth may be necessary if the abscess is associated with severe periodontal destruction. Provisional replacements help maintain function and aesthetics during this phase. Addressing periodontal abscesses promptly is essential for stabilizing the patient and preparing for further periodontal interventions. Extracting hopeless teeth is a key part of the preliminary phase. Teeth that cannot be saved due to extensive decay or periodontal disease are removed to prevent further complications. Provisional replacements, such as temporary bridges or dentures, may be provided to restore function and appearance. This step ensures that the mouth is free from sources of infection and prepares the patient for subsequent phases of therapy. Early extraction and replacement help maintain oral health and patient comfort. Phase 1 therapy, also known as the etiotropic phase, focuses on eliminating the causes of periodontal disease. This phase includes plaque control, diet management, removal of calculus, root planing, and correction of irrational restorative and prosthetic factors. The goal is to create an environment conducive to healing and prevent further disease progression. By addressing etiological factors, clinicians lay the groundwork for successful periodontal treatment. Let's delve into the specific procedures involved in Phase 1 therapy. Plaque control is fundamental to periodontal therapy. Patients are educated on proper oral hygiene techniques, including brushing and flossing. Regular removal of plaque prevents the accumulation of harmful bacteria, reducing inflammation and promoting healing. Diet control may also be recommended to minimize sugar intake and support oral health. Effective plaque control sets the stage for all subsequent periodontal procedures, ensuring a clean and healthy environment for the gums and teeth. Diet control plays a significant role in maintaining periodontal health. Patients are advised to limit sugary foods and beverages, which can contribute to plaque formation and caries. A balanced diet supports overall oral health and aids in the healing process. By making dietary adjustments, patients can reduce risk factors for periodontal disease and enhance the effectiveness of other therapeutic procedures. Diet control is a simple yet powerful tool in the fight against gum disease. Removal of calculus, or tartar, is essential in Phase 1 therapy. Calculus is hardened plaque that cannot be removed by brushing alone. Professional cleaning, including scaling and root planing, is performed to eliminate calculus deposits from the teeth and roots. This procedure reduces inflammation, prevents further periodontal destruction, and promotes tissue healing. Calculus removal is a cornerstone of periodontal therapy, ensuring a clean foundation for the gums and supporting structures. Root planing is a meticulous procedure aimed at smoothing the root surfaces of teeth. This process removes residual calculus and bacterial toxins, creating a healthy environment for gum reattachment. Root planing helps reduce pocket depth and gingival inflammation, improving overall periodontal health. By ensuring the roots are clean and smooth, clinicians facilitate healing and prevent recurrence of disease. Root planing is often combined with scaling for optimal results. Correction of irrational, restorative, and prosthetic factors is crucial in Phase 1 therapy. Faulty restorations, overhanging margins, and poorly fitting prostheses can contribute to plaque accumulation and periodontal disease. By addressing these issues, clinicians eliminate sources of irritation and promote a healthier oral environment. Temporary or final restorations may be placed to restore function and aesthetics. This step ensures that restorative work supports, rather than hinders, periodontal health. Excavation of caries and placement of restorations, whether temporary or final, is an important aspect of Phase 1 therapy. Removing decayed tissue prevents further damage and infection. Restorations restore the integrity of the tooth, allowing for proper function and aesthetics. This step is essential for creating a stable foundation for periodontal healing and preventing recurrence of disease. Caries management is integrated with other therapeutic procedures for comprehensive care. Antimicrobial therapy is used to control bacterial populations in the mouth. This may involve topical or systemic antibiotics, as well as antiseptic rinses. By reducing harmful bacteria, clinicians can minimize inflammation and promote healing. Antimicrobial therapy is often used in conjunction with mechanical cleaning procedures for optimal results. This approach helps manage periodontal infections and supports the overall treatment plan. Occlusal therapy addresses issues related to the bite and alignment of teeth. Problems such as malocclusion can contribute to periodontal disease by causing excessive forces on the gums and supporting structures. Minor orthodontic movement may be performed to correct these issues. Occlusal adjustments help distribute forces evenly, reducing trauma and supporting periodontal health. This step is integrated into Phase 1 therapy to ensure a stable and functional dentition. Minor orthodontic movement may be necessary to correct slight misalignments that affect periodontal health. By repositioning teeth, clinicians can improve access for cleaning and reduce areas of plaque accumulation. This step supports overall oral hygiene and enhances the effectiveness of other therapeutic procedures. Minor orthodontic adjustments are carefully planned to ensure minimal discomfort and optimal results for the patient. Assessing pocket depth and gingival inflammation is an important part of Phase 1 therapy. Deep pockets and inflamed gums indicate active periodontal disease. By measuring these parameters, clinicians can evaluate the effectiveness of initial therapy and plan further interventions. Provisional splinting may be used to stabilize mobile teeth during this phase. Monitoring pocket depth and inflammation guides the treatment plan and ensures optimal outcomes. Provisional splinting is used to stabilize teeth that are mobile due to periodontal disease. Temporary splints help distribute forces evenly and provide comfort during the healing process. This technique is especially useful in cases where mobility threatens the integrity of the dentition. By stabilizing teeth, clinicians can enhance the effectiveness of other therapeutic procedures and support tissue healing. Provisional splinting is a valuable tool in Phase 1 therapy. After completing Phase 1 therapy, the response is carefully evaluated. This involves rechecking for plaque, calculus, and caries. The effectiveness of initial procedures is assessed, and any remaining issues are addressed. Evaluation ensures that the patient is ready for the next phase of treatment and that periodontal health is improving. By monitoring progress, clinicians can make informed decisions and adjust the treatment plan as needed. Phase 2 therapy, also known as the surgical phase, involves periodontal surgical procedures to further improve oral health. These procedures include pocket reduction, regenerative techniques, and periodontal plastic surgery. The goal is to eliminate or reduce pockets, enhance tissue regeneration, and improve aesthetics. Surgical interventions are carefully planned based on the response to Phase 1 therapy. Let's explore the various surgical procedures involved in Phase 2 therapy. Pocket reduction or elimination procedures are designed to decrease the depth of periodontal pockets. Techniques such as gingivectomy and periodontal flap surgery are used to remove diseased tissue and promote healing. Regenerative procedures may also be performed to restore lost bone and gum tissue. By reducing pocket depth, clinicians can improve access for cleaning and prevent further disease progression. Pocket reduction is a key component of surgical therapy. Gingivectomy is a surgical procedure that removes excess gum tissue to eliminate pockets and improve oral hygiene. This technique is used when pockets are caused by overgrowth of the gums. By removing diseased tissue, clinicians can reduce inflammation and enhance access for cleaning. Gingivectomy is performed with precision to ensure optimal healing and aesthetics. It is an important tool in the surgical phase of periodontal therapy. Periodontal flap surgery involves lifting the gum tissue to access the roots and bone beneath. This allows for thorough cleaning and removal of diseased tissue. Flap surgery can also facilitate regenerative procedures to restore lost bone and gum tissue. By improving access, clinicians can achieve better outcomes and promote healing. Flap surgery is a versatile technique used in the surgical phase of periodontal therapy. Regenerative procedures aim to restore lost bone and gum tissue. Techniques such as guided bone regeneration and connective tissue grafts are used to promote healing and reattachment. These procedures are carefully planned based on the extent of tissue loss and the patient's needs. Regeneration enhances the stability of the dentition and improves overall periodontal health. By restoring lost structures, clinicians can achieve long-term success in periodontal therapy. Periodontal plastic surgery techniques are used to improve the appearance and function of the gums. Procedures such as root coverage and epithelial grafts help correct gum recession and enhance aesthetics. These techniques can also widen the width of attached gingiva, providing better support for the teeth. Periodontal plastic surgery is tailored to each patient's needs, ensuring optimal results and satisfaction. Root coverage procedures, such as connective tissue grafts and epithelial grafts, are performed to cover exposed roots and correct gum recession. These techniques restore the natural contour of the gums and protect the roots from sensitivity and decay. By improving gum coverage, clinicians enhance both function and aesthetics. Root coverage is an important aspect of periodontal plastic surgery, providing lasting benefits for patients. Widening the width of attached gingiva is sometimes necessary to provide better support for the teeth. Surgical techniques are used to increase the amount of firm, attached gum tissue. This enhances the stability of the dentition and reduces the risk of further recession. By improving the quality and quantity of attached gingiva, clinicians can achieve better long-term outcomes in periodontal therapy. Pre-prosthetic surgical procedures are performed to prepare the mouth for final restorations. Techniques such as crown lengthening and ridge augmentation are used to create a stable foundation for prosthetic work. Crown lengthening may involve osseous recontouring to expose more tooth structure. Ridge augmentation restores lost bone, ensuring proper fit and function of prostheses. Pre-prosthetic surgery is essential for successful restorative outcomes. Crown lengthening is performed to expose more tooth structure for restorative procedures. This may involve removing gum tissue and reshaping the underlying bone. By increasing the length of the crown, clinicians ensure proper fit and retention of prostheses. Crown lengthening is carefully planned to achieve optimal aesthetics and function. It is a key step in pre-prosthetic surgery and restorative therapy. Ridge augmentation is used to restore lost bone in the jaw, creating a stable foundation for prosthetic work. This procedure involves grafting bone or other materials to rebuild the ridge. Ridge augmentation ensures proper fit and function of prostheses, enhancing both aesthetics and stability. By restoring the ridge, clinicians can achieve successful outcomes in restorative and implant therapy. Osseous surgeries include both resective and regenerative techniques to manage bone defects. Resective surgery removes diseased bone, while regenerative surgery aims to restore lost bone. These procedures are tailored to the patient's needs and the extent of periodontal destruction. Osseous surgeries enhance the stability of the dentition and support long-term periodontal health. By addressing bone defects, clinicians can achieve better outcomes in periodontal therapy. Implant surgery is performed to replace missing teeth and restore function. Techniques, such as guided bone regeneration and sinus lift procedures, are used to prepare the site for implant placement. Implants provide a stable and durable solution for tooth loss, enhancing both aesthetics and function. Implant surgery is carefully planned to ensure optimal outcomes and patient satisfaction. It is an important component of modern periodontal therapy. Guided bone regeneration is a technique used to promote the growth of new bone in areas of deficiency. Special membranes and graft materials are placed to encourage bone formation and support implant placement. This procedure enhances the stability and longevity of implants, ensuring successful outcomes. Guided bone regeneration is a critical step in implant surgery and advanced periodontal therapy. Sinus lift procedures are performed to increase the amount of bone in the upper jaw for implant placement. This involves lifting the sinus membrane and adding bone graft material. Sinus lifts create a stable foundation for implants, ensuring proper fit and function. By addressing bone deficiencies, clinicians can expand treatment options and achieve better results in implant therapy. After surgical procedures are completed, the response is re-evaluated. Clinicians assess healing, pocket depth, and tissue regeneration. Any remaining issues are addressed before moving to the restorative phase. Re-evaluation ensures that surgical interventions have achieved their goals and that the patient is ready for final restorations. Monitoring progress is essential for long-term success in periodontal therapy. Phase 3 therapy, also known as the restorative phase, involves placing final restorations and prostheses. The goal is to restore function, aesthetics, and stability to the dentition. Fixed and removable prostheses are carefully designed to meet the patient's needs. Evaluation of response to restorative procedures ensures that the restorations are functioning properly and supporting periodontal health. Let's explore the key aspects of the restorative phase. Final restorations are placed to restore the integrity and function of the dentition. These may include crowns, bridges, or dentures, depending on the patient's needs. Restorations are designed to fit precisely and support oral health. By restoring damaged or missing teeth, clinicians enhance both function and aesthetics. Final restorations are a critical step in achieving long-term success in periodontal therapy. Fixed prostheses, such as crowns and bridges, are permanently attached to the teeth or implants. These restorations provide stability and durability, supporting both function and aesthetics. Fixed prostheses are carefully designed to match the patient's natural teeth and enhance oral health. By providing a stable solution, clinicians ensure long-term success and patient satisfaction. Removable prostheses, such as dentures, are used to replace missing teeth and restore function. These restorations can be taken out for cleaning and maintenance. Removable prostheses are designed for comfort and aesthetics. providing a flexible solution for tooth loss. By restoring function and appearance, clinicians enhance the patient's quality of life and oral health. After placing final restorations, the response is evaluated to ensure proper function and support for periodontal health. Clinicians assess the fit, stability, and aesthetics of the prostheses. Any adjustments are made as needed to optimize outcomes. Periodontal examination is performed to monitor the health of the supporting tissues. Re-evaluation ensures that the restorative phase has achieved its goals and that the patient is ready for maintenance. Periodontal examination is performed after restorative procedures to assess the health of the gums and supporting structures. Clinicians check for pocket depth, inflammation, and mobility. This evaluation helps identify any remaining issues and guides further therapy if needed. By monitoring periodontal health, clinicians ensure long-term success and stability for the patient. Phase 4 therapy, also known as the maintenance phase, is essential for preserving periodontal health. This phase involves periodic recall visits, checking for plaque and calculus, and monitoring gingival condition. Maintenance ensures that any issues are detected early and addressed promptly. By maintaining regular follow-up, clinicians support long-term oral health and prevent recurrence of disease. Periodic recall visits are scheduled to monitor the patient's oral health and detect any changes early. During these visits, clinicians check for plaque, calculus, and gingival condition. Regular follow-up allows for timely intervention and supports long-term success. Recall visits are a cornerstone of the maintenance phase, ensuring that periodontal health is preserved. Monitoring the condition of the gums is essential during the maintenance phase. Clinicians check for pockets, inflammation, and other pathologic changes. Early detection of issues allows for prompt treatment and prevents progression of disease. By keeping a close eye on gingival health, clinicians support the stability and longevity of the dentition. During maintenance, clinicians assess occlusion, tooth mobility, and other pathologic changes. Proper occlusion ensures even distribution of forces and prevents trauma to the gums and supporting structures. Mobility assessment helps identify any weakening of the supporting tissues. By monitoring these parameters, clinicians can intervene early and maintain periodontal health. The objectives of the re-evaluation phase are to assess tissue response after therapy, check for gingival inflammation, pocket depth and mobility, and evaluate patient compliance with oral hygiene. Clinicians review plaque and bleeding indices, oral hygiene status, and plan for any further periodontal therapy if needed. Re-evaluation ensures that the treatment plan has achieved its goals and guides future care for optimal periodontal health.